The conversation about internship is not just about posting. It's a bigger conversation about healthcare financing. That we must get our financing for healthcare right, so that then we can take care of all pillars of universal health coverage. What we have launched here today is to ensure that the commodities are available, they are assured. We have a pillar on human resources, and that is where the interns plug in. So, and for the record, interns have always had a challenge at the time of posting. It is not starting with this government. It is not starting with me as the cabinet secretary. It has always been there many years ago. And Dr. Nikal is here. He'll tell you that this internship has been a big issue. So what is there for now, the reason why we are not able to post interns immediately, one is that we have to ensure that wherever they are going, they are able to get the training that they need to finish and get the license. For that training to be available, we need to have the internship centers adequately equipped for them to find equipment to use. We need to ensure the internship centers have medical officers and specialists who will supervise them. We need to ensure that health commodities are available that they will use during their internship time. So the last thing that we need to do then is to compensate them for their time during internship. In 2017, the KMPDU, Kenya Medical Practitioner and Dentist Union, signed a CBA regarding their internship to the level that their compensation per internship is 206,000 per month. That includes a salary and allowances. For now, that is unsustainable. As a ministry, we do not have resources to post them. And the law does not allow us as a ministry to post when we do not have budget for it. So we have requested for the budget from Treasury of 4.9 billion shillings. So there are many things that we are doing, some for the long term, which is just looking at the policy, also to ensure that once they graduate, they do not stay out for long. So we are going to work around a policy change to ensure that they are able to go immediately into their internship. And number two, that they are compensated, because you know, their internship is not like any other internship. I appreciate as the minister that they are normally at the front line in terms of service delivery. So it's an internship much more than the other internship. So again is to see how can we appropriately compensate them for that, but in a sustainable way that we can always take care of them. Yesterday, my principal secretary for professional standards and public health met with the unions. They had discussions, and the report that I received in the evening is that we are going to continue to have another discussion, and for now is to ask the interns to be patient as we make plans to ensure that they are posted. If they went to a strike, who will suffer? It's the common Kenyan, the patient.
One, we need to look at the training of our doctors in this country, because apparently universities are channeling huge numbers without considering where they are going. Universities must be able to be regulated to train the number of doctors that are required within the market, because it is becoming a huge business for them to train doctors and not knowing where they are going. Two, we have only for 5 hospitals. In the past, we had, when we were training interns, we were posting them to mission hospitals and also private hospitals like Aga Khan. And Aga Khan was paying their interns. Private mission hospitals were paying their interns. So we need this conversation around. It should not just be that it is the national government that pays the interns, because these interns, wherever they'll be working, they are also working for those hospitals. Can we have a conversation around all the internship training centers so that you have enough spaces, and those institutions must also pay for those interns? Because if an intern is coming to work in a mission hospital or even Nairobi Hospital or Aga Khan Hospital, then that hospital must pay for them. Today you ask yourself, if there are hospitals who are not taking interns, yet they have the facilities that they could train these interns. And after the interns have completed, they are going to work in these institutions. So we want to, all this is a huge conversation that we should all of us be able to discuss, agree,